Good day everyone, I'm Nika Laizal Conistaller with my co-members, Ms. Bakidan, Ms. Lianco, Ms. Canyazo, and Mr. Milo, and we're going to discuss about Dr. Carmelita de Vinegarcia and her theory or model. So, our presentation focuses to getting to know the theories, the theoretical sources of her theory, the meta-paradigm of nursing, theoretical framework, and lastly, the major concept of her model. So, who is Dr. Carmelita de Vinegarcia? Dr. de Vinegarcia is a Filipino nurse theorist, and she is a part of Association of the Deans Philippine College of Nursing or the ADPC and former president. She is a Dean of University of the East Ramon Magsaysay Memorial Medical Center Incorporation or the UERMMC College of Nursing. She also member of JED's Technical Committee on Nursing Education, and she has been lauded for developing the art and competency of teaching nursing. And Dr. de Vinegarcia has been a clinical nurse, staff nurse, head nurse, instructor, assistant dean, and also she is a dean. And Dr. de Vinegarcia is an expert in research and education. So now let's tackle her education journey. She has lectured and written about her work as a nurse and has used her hands-on experience to develop better ways to teach nursing. Also, Dr. Carmelita de Vinegarcia, master's degree in nursing at the University of the Philippines in 1975. Doctorate's degree in nursing at the University of the Philippines also in 2001. And she is awarded as a recipient of the Anastasia Giron Topaz Award given by the Philippine Nursing Association or the PNA in 2008. So now let's tackle her theoretical sources of her theory. One of her sources is her love for nursing, and her dedication to carve out learning tools for nursing students has been a commendable and rare field of these disciplines. The second one sources of her theory is the composure behaviors have been inspired to the principle of holistic care, which composure behaviors is a condition in a state of well-being, a coordinated and integrated living pattern that involves the dimension of wellness. And the last one is the advanced nurse practitioner composure behavior and patient's wellness outcome, which advanced nurse practitioner are DBS and graduate, licensed and has clinical experience of at least 2 years in the clinical area. Third one has the undergo special training in the clinical area, and the last one has a set of behaviors or nursing measures that the nurse demonstrates to selected cardiac patients. Also, the wellness status refers to a condition of being in a state of well-being, a coordinated and integral living pattern that involves the dimension of wellness. So now, let's proceed to meta-paradigm of nursing.
Person. In the Vinegarcia's model, the person refers to the individual or group receiving care. The person is viewed holistically, encompassing physical, emotional, and social spiritual dimensions. They are active participants in their own care, with unique needs, values, and experiences shaping their health journey. Health. Health in the Vinegarcia's model is defined as a state of well-being in which the person is able to achieve their full potential, manage challenges, and maintain balance in their life. It's a dynamic and evolving process and includes physical, emotional, and spiritual dimensions. Environment. The environment encompasses all external factors that influence the person's health and well-being. The environment is not merely a backdrop, but an active participant, influencing the person's health and well-being. This includes both the physical and sociocultural aspects of the environment. Nursing care. The quality of nursing care could be improved using an intervention. Nurses, according to the Vinegarcia's model, are not just providers of technical care, but also facilitator of healing, advocates for patients and agents for improving the conditions that affect health. They play a crucial role in creating an environment conducive to health and in helping individuals navigate the complexities of their health journey.
So this is the theoretical framework of Carmelita C. Divina Gracia. Carmelita C. Divina Gracia conducted a study to determine the effects of composure behaviors of the advanced practitioner on the recovery of selected patients at the Philippine Heart Center. Behaviors include competence, presence and prayer, open-mindedness, stimulation, understanding, respect and relaxation, and empathy. Is a set behaviors determined by Dr. Divina Gracia that would be demonstrated by advanced nurse practitioners to see how it would affect the recovery of the patients in the coronary care unit of the Philippine Heart Center. So this is the composure behaviors. First, the competence. Second, the presence and prayer. Third, the open-mindedness. Fourth, stimulation. Fifth, understanding. Sixth is respect. Seventh, the relaxation. And lastly, the empathy. So let's hear for Ms. Liangco for the explanation of these composure behaviors.
Composure behavior refers to a holistic approach to patient care, emphasizing professionalism, emotional stability, and a compassionate demeanor while addressing patients' physical, emotional, and spiritual needs. It is built on specific values and traits represented by the acronym composure, which competence is an in-depth knowledge and clinical expertise demonstrated in caring for patients. This also stands for consistency and congruency of words and deeds of the nurse. Nurses should maintain up-to-date clinical expertise and skills through continuous learning and training. Competence ensures consistency in delivering high-quality care and fosters trust between the nurse and patient. Presence and prayer is a form of nursing measure, which means being with another person during times of need. This includes therapeutic communication, active listening, and touch. It is also a form of nursing measure which is demonstrated through reciting a prayer with the patient and concretized through the nurse's personal relationship and faith in God. Beyond physical presence, nurses should be emotionally and spiritually supportive, offering reassurance and prayer as needed. The use of therapeutic communication techniques, such as active listening and providing comforting words, strengthens the nurse-patient relationship. Open-mindedness is a form of nursing measure which means being receptive to new ideas or to reason. It conveys a manner of considering patients' preferences and opinions related to his current health condition and practices and demonstrate the flexibility of the nurse to accommodate late patients' views. Nurses should respect patients' preferences, cultural beliefs, and values, accommodating their choices whenever possible. Flexibility in care planning promotes shared decision-making and patient autonomy. Stimulation is a form of nursing measure demonstrated by means of providing encouragement that conveys hope and strength, guidance in the form of giving explanation and supervision when doing certain procedures to patients, use of complimentary words, or praise and smile whenever appropriate. Appreciation of what patient can do is reinforced through positive encouraging remarks, and this is done with kind and approving behavioral approach. Offering words of appreciation, celebrating small victories, and recognizing progress can empower the patients. This approach fosters a sense of optimism and resilience during recovery. Understanding. According to Dr. Divina Gracia, it conveys interest and acceptance not only of patient's condition but also his entire being. This is also manifested through concerned and affable facial approach. This is a way of making the patient feel important and unique. Active listening and empathetic response ensure patients feel heard and valued. Understanding also involves recognizing non-verbal cues to assess patients' discomfort or needs. Respect means acknowledging the 31 patient's presence. Use of preferred naming in addressing the patient. Po and opo is a sign of positive regard. It is also shown through respectful nods and recognition of the patient as someone important. Nurses should show respect by addressing patients appropriately, seeking consent, and maintaining confidentiality. Respecting boundaries and cultural differences strengthens trust and collaboration. Relaxation entails a form of exercise that involves alternate tension and relaxation of selected group of muscles. So nurses can guide patients through relaxation exercises such as deep breathing or meditation, creating a tranquil environment in the care setting supports mental and physical relaxation. Empathy senses accurately other person's inner experience. So the empathic nurse perceives the current positive thought and feelings and communicates by putting himself in the patient's place. So nurses can convey empathy through verbal and non-verbal communication, such as maintaining eye contact and using compassionate language. Empathy allows nurses to provide patient-centered care, addressing emotional and physiological needs.
First one is patient wellness outcome. This refers to the overall health status and quality of life of a patient, incorporating both physical and mental health aspects. It evaluates how well a patient is managing their condition, recovery, or general health after treatment or intervention. Key aspects of patient wellness outcomes include physical health, for example, pain management, mobility, and the presence or absence of disease symptoms. The second one of key aspects is physiological health. For example, emotional well-being, mental clarity, and the ability to cope with stress or illness. Next is social well-being. These are like relationships, social support, the ability to engage in activity. Last but not the least of key aspects of patient wellness outcome is spiritual well-being, a sense of purpose or meaning or the ability to align one's values and actions with a greater good. Next one is physiological wellness outcome. This specific type of wellness outcome focuses on the physical aspects of a patient's health. It measures how well the patient's body functions and recovers from illness, injury, or surgery. Example includes vital signs, blood pressure like that, nutritional status, weight, laboratory markers, or blood sugars. Functional capacity, physical activity levels, muscle strength, and many more. Disease markers, results from tests that track disease progress, such as cancer markers. The last one is bio-behavioral wellness outcome. Bio-behavioral wellness outcome integrate both biological and behavioral aspects of health. This category recognizes that a patient's physical health is influenced not only by biological factors like genetics or disease processes, but also by their behavioral and lifestyle choices, such as diet, exercise, and stress management. Key aspects include biological factors, meaning physiological measures like hormone levels, immune function, and genetic predispositions. Next is behavioral factors. For example, health behaviors like smoking, alcohol consumption, exercise, sleep habits, and stress management. Next is physiological and emotional health. Example is coping mechanisms, mental health, stability, and emotional regulations. Last but not the least is social factors. For example, family dynamics, community engagements, and social support system.